Hello, everybody. Welcome to today's webinar on the Skin90 treatment planning protocol, focused specifically on dehydrated skin. I'm hoping to manage my time effectively today and deliver this webinar within 30 minutes. I know everyone's busy, and so I'm hoping to stay that timeline. As always, I've muted everybody to ensure that everyone's going to have the right experience through this webinar, and we minimize any kind of audio interference. If anyone has any questions through this webinar, please make use of the messaging feature and add your questions to the messaging feature. And if there's time at the end, I will get to those questions. If there isn't time, we'll certainly follow up on any of those questions. I'd like to also note that what I'm really focused on here is the treatment planning methodology. So how to treatment plan around dehydrated skin, and so it's going to be less product focused and more sort of treatment planning focused, but we'll highlight some of the products at the end. And I would draw your attention to the fact that within our Skin Health College online learning environment, there is an entire lesson dedicated to treating dehydrated skin and the associated products. So I think it's an opportunity to follow up on this webinar and get any deeper technical knowledge that you may be looking for. So that being said, general flow of the webinar, we're going to talk just a bit about what is Skin90. We're going to talk a bit about the skin. We're going to talk a bit about establishing your mandate as a clinician. So what is the customer or your client looking for, and how do you understand their needs? Then we're going to talk about the plan, so the actual planning process, have a quick look at products, and at the end I wanted to share a bit of an offer code around a giveaway that we're doing related to this webinar. So let's get going. And thank you again for joining me. My name is David Potter. So Skin90 is basically a methodology that we built to help support effective treatment planning in clinic. Skin90 is intended to be a 90-day treatment planning methodology, and its sole purpose is really to help support you in delivering results to your clients. Essentially, the program, there's a bit of a diagram there that kind of articulates the value proposition of the program. And so there's three core elements to the treatment planning process, and then there's a call out, a fourth specific element. So simply put, it's about feed, boost, and finish. Feed is about what you're coaching your client to do at home every day with their skin. Boost is essentially what you're going to bring them into your clinic to do. Target is targeting specific skin issues. So in this case, for example, targeting dehydrated skin. And then finish is really about how to integrate injectables into a practice and into a treatment plan. So it's ultimately the end product. So some of you may be asking, Skin90, 90 days, why 90 days? So 90 days is important because, as you can see in the diagram, it gives us about 3 skin cycles to work with. So depending on your age and the health of your skin, there's anywhere from sort of 24 to 30-day turnaround on skin. So that means the skin is essentially regenerating itself every month. And so what we wanted to do in developing a treatment plan to achieve any kind of a goal for a client, is give ourselves 3 skin cycles or 3 months to achieve the results that they're looking for. Obviously, each skin cycle and each week within each skin cycle, there's going to be progressive improvement towards their goal, but we're wanting to give ourselves enough time to see sustainable change. Obviously, we've all seen you can apply a moisturizer to the skin and there's an instant visual change to the skin. But in order to achieve real change, we need to give ourselves at least 3 months. Then below that, you see just some basic calculations, and it's really meant to articulate a bit about the value proposition here. So when we talk about changing how someone feeds their skin, we're essentially changing what they're doing to their skin every single day. So you can see that what feed entails is really what you're doing to your skin daily, and it's really twice daily. So in the morning and in the evening. And so essentially you get 60 treatment incidences, or 60 treatments during the month. And so the feed, we're really saying, what are you going to do over this skin cycle 60 times to achieve your outcome? Then obviously it's repeated over the 3 cycles. The boost is really talking about what we can achieve in clinic. And so when we get into the planning cycle, you'll see that what we talk about with boost is we talk about weekly, bi-weekly, or monthly treatment frequencies. So what we like to do is we like to articulate how frequently someone's going to be coming into the clinic to be treated by you. And when we use the DF machine technology, so the DF enzyme technology associated with Environ, we can, in all intents and purposes, we can, 1 treatment in clinic is equal to 40 regular treatments at home, or 30 to 40 regular treatments at home. So when we are looking for a transformational program, we're essentially effectively delivering 160 treatments over a skin cycle, or treatment incidences over a skin cycle. And then the finish element is associated with injectables, which may or may not be required based on what the patient is looking to achieve. So really it's an over holistic planning process that you can implement in your clinic to integrate what people are doing at home, what we're going to do with them in clinic, and then if you have an injectables practice, what we're doing from an injectables perspective. There's a start and there's an end, and we'll get into that a bit more as we go through. Let's just set the stage a bit on Skin90. To give you a sense of it, so what we've done to help support the process within your clinic is really provided a clear documentation process for you in clinic. So this is what Skin90 looks like on paper, essentially. And so anytime someone's coming into your clinic, whether it's a new clinic intake or a new client intake, or whether it's a new client planning session, this is the template that you would use. It starts with the first page, which is really an interview and questioning and a process to get to know what the client's has the prior history, skin history of the client, what they've tried in the past, and what they're looking to achieve through a bit of a skin assessment. And that's going to establish what the issue is with the skin and what's the mandate. So what are they looking to achieve with you? Then the other 2 pages in this treatment planning protocol is the plan itself. And as you can see there in this slide, it's highlighted that there's 4 sections to the plan. There's a feed section, which is how you will write the at-home program plan. The boost section, which is how you'll write the in-clinic treatment plan. And then the target, which is how can you target specific issues with at-home product. And then lastly, the finish element, which is prescribing injectables when and if needed. What's important to note as well through the Skin90 process is that it's laid out in a very prescriptive way. And so the form and the process is meant to be followed from start to finish in a very specific order, which is a bit different. I mean, a lot of us run clinics and we have a focus on services, rightly so, where we're wanting to bring patients or clients into clinic and treat them. And that's a really highly effective way of enabling change. And really important way of achieving goals. But what Skin90 really attempts to do is to re-vector that a little bit, which is to say that if we're going to look to achieve any kind of a goal, skin goal with a client, it always needs to start with what they're doing at home. What they're doing at home is what they're going to do, what kind of a habit they're forming around their skin. And it's where we can have the biggest lifelong impact on their goals and on their skin. And so where a lot of treatment planning and clinics start with the service, start with what treatment are we going to recommend that you do in clinic, and then try and sell home care after that. What Skin90 really says is that the starting point of any kind of skin change is really what you're doing at home. We then build on top of that what we want to do with you in clinic. And then on top of that, what we want to do to target specific skin issues. And then lastly, what we want to do to finish the skin. So we would never start with finish, or we'd never start with target, we'd never start with boost. We always start with feed, then we move to boost, then we move to target, then we move to finish. It's also when you're talking about someone with a defined budget in mind that they can spend and afford, this is how we want to spend money to achieve the best outcome over a lifetime. First, we want to invest in what you're doing at home. Then we want to invest in what we can do for you in clinic. Then we want to invest with very specific targeting elements. And then we want to invest in finish. So it's a very strategic plan, a very specific methodology and approach to how to really meaningfully change skin. It's called Skin90. And I look forward to sharing it with you in more detail. As mentioned, what we're really targeting in this webinar is the idea of dehydrated skin, which is a very common issue. So let's get into it in a bit more detail. And we start with the first page in the treatment planning process, which is what's your skin treatment profile and how do we assess your skin today? So what are your skin issues? What's most of concern to you? That helps us define what the skin issue is and then define the mandate. You'll see here that there's a little icon on this slide, mirror icon. This is an important point I wanted to highlight, in that there's lots of different technologies out in the marketplace that are often used to assess skin. Some of the brands out there or devices out there are, for example, Vizia, where you're using some either some blue light or some other sort of diagnostic skin capabilities to try and assess the health of the skin and try and assess what's happening with the skin. And you can get a whole bunch of really sophisticated data points. What we prefer to recommend in our treatment planning process is the mirror. Why we like to use the mirror is a couple of reasons, or a handful of reasons. One is that the mirror is a trigger for what the client or the customer is seeing of themselves every single day. And so when you are trying to diagnose issues, one is what is the actual health of the skin and what's the actual issue with the skin? But more importantly is what's the client's perception of their skin health and their skin issues? And that perception is triggered when looking in the mirror. So what we like to use is a side-by-side technique in clinic where we both, you, the technician, and the client look together in the mirror at themselves and go through an assessment process of what they're seeing and what their concerns are. And it's a bit of a prompted process. So you're obviously going through it and asking them for what they're seeing. And then you're also looking at other things that you might be seeing and using great questions to reveal whether that's a concern that they have as well. You'll see in this skin assessment phase, there's cosmetic, structural, disease, and other. And then there's a scale of 1 to 4. And so essentially, you're going to be going through this, and you're going to be going through all these and seeing if it's an issue with the client, and if it's an issue that you see, and then you're grading it on a scale of 1 to 4. 4 being most concerned about it. So you may have areas of concern, low concern, and areas of high concern. What you're really looking to do through this process is understand the issue with the skin and the mandate you have. So what they're looking to achieve over that 90-day period. So in this case, when we talk about the skin, we're talking about dehydrated skin. So the place obviously to start with dehydrated skin is skin type. So as you know, with skin, there's skin type, and skin type is basically primarily genetic based. So it's what's called an intrinsic factor. So this is kind of the type of skin that you're born with. And there's really three types of skin. There's dry skin, there's normal skin, and there's oily skin. There's also some people call a combination skin, which is sort of in between dry and oily, which we're framing as normal here. But those are basically your 3 skin types. So first and foremost, when you're looking at someone's skin, you're trying to put them into one of those categories, dry, normal, and oily. What really, when you're looking to diagnose skin type, you're really looking visually at it. You're looking for an opportunity to ask about history over time. So is this something that has happened periodically, or is this something that you struggled with over a long period of time? You're looking at sort of how prevalent it is on multiple areas of the body. So is it just a localized thing, or is it something that's happening just more broadly, so generally around the skin? So when the skin presents as with a dull appearance, when you see sort of signs of redness on the cheeks, you're seeing rough texture to the skin, and you're really seeing minimal sebaceous secretion. So very obviously not any kind of oil on the skin or any kind of lubricant on the skin. You're going to see and diagnose a dry skin type. So when we talk about dehydrated skin, there's obviously a tight correlation between type of skin and skin condition. So in this case, we're really dealing mostly with people that are presenting with a dry skin type. And when we're looking at writing a treatment plan, we're obviously wanting to understand that. Next is skin condition. So this is more of the extrinsic factors. So these are environmental, lifestyle, pollutants. This is what is happening to the skin, and it's mainly extrinsic. So you're not born with it, but it's a condition that's developed based on those factors: what you do in your life, your diet, your lifestyle, your health, and then factors like pollution and climate. So when we're looking at dehydrated skin and we're looking at diagnosing dehydrated skin, we're looking at two sort of kind of key areas: the forehead and the cheek, because that's where it's going to show up most prevalently and most commonly. And what you're seeing here is we're looking at three different categories. So we're looking at appearance, we're looking at texture, and we're looking at secretion. So how do these three factors play in? Well, with dehydrated skin, the appearance is going to be sort of fine cracks and flaking. The texture is going to be rough dryness, and there's going to be very low oil levels and decreased moisture. So no secretion, rough texture, dryness, and fine cracks and flaking on the skin. And that's a real telltale sign of dehydrated skin. So you're going to then start to, so you're first going to sort of try and identify what the skin type is. So you're going to have a dry skin type. Then you're going to look at the skin condition and identify dehydrated skin. And dehydrated skin is often to do with the health of the skin. So just what I've shown there are some pictures of dehydrated skin and how it presents itself. There's obviously dehydrated skin is also correlated with age. So as our skin ages, there's also the potential for it to be more dry and dehydrated. So there's sometimes a whole confluence of factors or issues that are leading to dehydrated skin. But I just wanted to obviously present how it, or show how it presents itself most commonly. And then also just talk very quickly about some of what the underlying issue is in the skin. So when we talk about dehydrated skin, we talk about the trans-epidermal water loss. So obviously the skin's primary function is a barrier function, and that barrier function is designed to keep harmful things out and keep moisture in. And so when we have a compromised barrier function, so we're looking at the horny layer outside of the skin, also called the stratum corneum, we're looking at exacerbated epidermal water loss, which means that we're losing a lot of hydration out into the atmosphere, out into the outside. And that causes the skin function to slow and starts to cause the skin to not function properly, which then compounds some other issues. So some of it is natural moisturizing factors, NMFs, that are naturally occurring within the body that help to protect and moisturize the skin. So production of those NMFs decreases. And then there's also humectants within the skin, things like hyaluronic acid that are sugars that attract water and plump the skin and hydrate the skin. And so as the skin loses hydration through trans-epidermal water loss and a compromised barrier function, some of those other functions within the moisturizing and hydrating functions within the skin also stop functioning. So production of natural moisturizing factors, as well as humectants like hyaluronic acid. One of the things I wanted to highlight here as well is just, if you see there's something called the Langerhan cell. So the Langerhan cell is like inflammation. So it's what happens when the skin starts to react to antigens and starts to react to disease in the skin. So obviously with a compromised barrier function, there's also the potential of external irritation and infection. And that's going to activate the Langerhan cells, and the Langerhan cells activate inflammation. So that's sort of the itchy side to dry, dehydrated skin. That's also important to note. And that's also a reaction to kind of what's happening in the skin. It's also one of those complicating factors when looking at hydrating skin and dry skin, in that it can also present as sensitive skin. So people with dry dehydrated skin can also complain of sensitivity, and that's really due to the action of the Langerhan cell and that sort of inflammation that's causing that sort of sensitive itchiness. So sometimes it's difficult to pull apart that diagnosis, and those two things can be happening at the same time. But often addressing the underlying issue, which is the barrier function, and then supporting normalization of cell function is going to help support both of those outcomes. So that's a bit about condition. I just wanted to note one more thing about condition, in that obviously there's a couple of diseases that are diagnosed often related to dry or dehydrated skin. And so there's eczema and there's psoriasis. So eczema is basically a disease issue associated with the barrier function. So we talked about the barrier function, the stratum corneum, the epidermal health. And eczema is essentially a disease associated with compromised barrier function. What I like to say sometimes about how to differentiate sort of just dehydrated skin from eczema is kind of like, how long has it been happening for? Is it something that happens, comes and goes, or is it there all the time? Obviously, it's the level of itching and pain. And so how much pain and itchiness is there? And then how pervasive it is. So obviously, when we're talking about dry skin happens everywhere, but the prevalence of dehydrated skin is going to be in the face, and where we're going to diagnose it most in the face. When we start to be more concerned about eczema is where it's all over the body. Particularly, you're looking at the elbows and knees to be able to see, is this just dehydrated skin or is this eczema? And with psoriasis, you're looking at more sort of, it's an autoimmune cell turnover disease, which means that the cell's producing too quickly, and so it leads to sort of a plaque buildup on the skin. It's also in that same elbow and knees area, and so you're also looking at the body to see, am I just dealing with dehydrated skin here, or am I dealing with something of a more pronounced disease state? To be honest, from a treatment planning perspective, our perspective, there's going to be a very similar approach, but when you're looking at a disease state, you're also looking at some medical interventions that go above and beyond what we can achieve with environment itself. So I wanted to talk a bit about the mandate. So when we were talking about this process, we're talking about what's the prior skin treatment profile and what's the skin assessment. What's really important here in using the mirror is we're also trying to understand the mandate. So despite what's happening with the skin and what we see happening with the skin, how does that person feel about their skin, and what are they looking to achieve, and over what period of time? And this is really important in the planning process, is to establish what the mandate is. And we simply like to think about it as 3 levels. So are we talking about a maintenance issue here? Are we talking about an improvement issue here? Or are we talking about a transformational issue here? So there's some people that are going to come in, they're suffering from dehydrated skin, but it's not something that's sort of, it's something that they've, that's in a management phase. It's something that they're dealing with. The severity of it's low, so it's not having a major sort of, it's not the top of the list in terms of their issues. The emotion that they have, so how do they feel about the issue it's curious. It's kind of like, well, you know, I have this, I have dehydrated dryness in my skin, you know, and I'm kind of interested in figuring out how to solve it. And then the timeline that they're in is like, hey, this is more of a maintenance timeline. So we're looking at sort of things that I'm looking to achieve over 180 days to a year. So it's just like, you know what, this is something that's top of mind for me. This is something that I'm looking to achieve. It's not sort of acute, and I've got some time. So help me figure out how to sort of start to make a dent and manage this. Then there's improve, which is, hey, this is of concern. It's been irritating to me. I've tried to solve it a couple of times in the past. I haven't been successful at it. I'm really looking to solve this thing, and so let's put this on the list of concerns. And I'm sort of looking at sort of over the next 90 to 180 days. I'd love to be in a place where this isn't an issue for me anymore. Then the last category or mandate is transform. So this is where we look at saying, okay, this is a major transformation. The person is suffering. This is a high anxiety element for them. They've tried multiple times to solve this problem. They haven't been able to solve it, and they're looking to solve it in a very specific amount of time. Sometimes that could be because something's happening in their life. They're getting married, they're going on a trip, something's happening. And so there's a high emotion, high concern, and tight timeline. And that's a transformational moment. So we're trying to put them into one of those three buckets: maintain, improve, or transform. Next, we get into the planning process. So this is, again, a step-by-step process that you follow to achieve the plan and outcome that you want to achieve with your client. And we sort of highlighted it a bit below, and now I'm going to step through it in a bit more detail. So here we are at the top of the form. You can see there in the red box. So this is the top two boxes. So at the very top of the form, this is where you're completing who the patient is, first name, last name, what the date is today, and what the check-in date's going to be 90 days from now. So those are two really important points when you talk about coaching or looking to achieve an outcome with someone, is the day you start to change their life, and then the next day that you're going to check in with them to measure results and outcomes. That's also where you see there's a picture taken, which is really important. So we want to take a picture before and after and at 90 days, because documenting the journey is really important. Obviously, you're the skin coach, so you put yourself there. And coach is a really important word because this is a process that you're going to go through together to achieve an outcome together. The objective, so what are we trying to achieve? We're trying to address skin dryness and dehydration in the skin. And we're trying to do it in a meaningful way. And then any associated notes. So the next conversation we're having is around feed. And so this is your essential treatment plan. So if you think about a skin type of dry, and you think about a condition of dehydrated skin, what are we going to do? So as you, with Environ, there's basically Skin Essentia, Youth Essentia, and Focus Care Clarity. There's Body, and there's Bend. And so what we're trying to do is step through this. So, and this is where mandate comes into play. So everyone is going to be put on one of these feed systems, which is something that's going to become their daily habit, twice daily habit. And so if someone's in that sort of maintain to improve zone, we're going to be recommending they get put on Skin Essentia. If someone's in that that improve to transform zone, we're going to suggest they get put on Youth Essentia. Simple as that. Obviously, budget plays a certain amount of role in this, but essentially we're delineating what range to put them on and what line to put them on based on that mandate. Is this a maintain mandate, or is this a maintain improve mandate, or is this an improve transform mandate? And then we're going to select the place that they're going to start. So As everyone will know with Environ, there's a step-up system which is going to graduate them to higher and higher dosage levels of vitamin A, C, E, antioxidants, hydrating factors, and peptides. And so that whole meal in a bottle is what we're going to step them up through from 1 to 5. And so if they're a new patient, we're obviously starting them on level 1. And then we're going to say that, you know, within 90 days, we're going to evaluate the potential to move to level 2. But we're going to start with level 1. So you would put an X in level 1 Skin Essentia box or in Youth Essentia box. Focus Care Clarity is got to do with acne, so we're not going to deal, or problematic skin, we're not going to deal with that. If the skin dryness is on their body as well, so and skin hydration, which often is going to be the case, we're going to recommend similarly that they look at treating their body. And essentially, there's 2 steps in the body. There's step 1 and step 2. The enhanced step is called Forte, and we're going to so we're going to put them on 102. You'll notice here as well that we don't get into talking about, you know, what cleanser and toner. We're talking about a feed system, which comes with the cleanser, the toner, and the step up. Why that's important is because when we get too complicated into talking about what the cleanser is and what the toner is and what the step up is, it starts to be complex, and clients start to try and decide around picking and choosing things. As you know, particularly with dehydrated dry skin, the cleanser and the toner are equally as important as the step up. And so this is a whole feed delivery system that works together as an ecosystem. You pull one thing out and it doesn't perform as well as you want it to perform. And so it's a pretty simple process. So everyone is going to choose something from the feed, and they're going to choose it based on the mandate. Next, we move to Boost. So this is often something people talk to me about because they're saying, well, hold on a second. There's a whole bunch of other products within the Environ lineup that I might want to recommend that target dehydrated or dry skin specifically. So within the Skin90 methodology, what the methodology calls for to affect the best result with the client is change what they feed at home, their base plan, their base meal plan, then bring them into clinic is the next best thing we can do for them to achieve the results they're looking for. And it's more important to do that than it would be to recommend a specific targeted product from the Focus Care range, for example, for a couple of reasons. One, using technology like the DF enzyme machine, we can really amplify what we can achieve and the speed with which we can achieve it. Two, there's a whole bunch of other treatments that you may have in your clinic that you may want to be recommending that really accelerate results. Three is probably the most important part, which is here in this moment, we're recommending and selling to the client frequency, which is really important. So how frequently could they plan to come into the clinic for treatments? Is it monthly? Is it bi-weekly? Or is it weekly? And that's what we're really getting to. So how frequently can you come into my clinic for me to treat you and to achieve the goal that you're looking to achieve? Generally, this links back to the mandate again. So if our mandate is sort of a maintain mandate, we're looking at monthly. If it's an improved mandate, we're looking at bi-weekly. If it's a transform mandate, we're wanting you in clinic weekly over the 90-day period. When you're in clinic, it provides us, one, an opportunity to really address the issue professionally. So, for example, using the DF machine and the ANC serum, for example, to rebuild the skin function and normalize the skin barrier function as quickly as possible to minimize trans-epidermal water loss, or to use hyaluronic acid, for example, as a spot treatment to add instant hydration to the skin. There's lots of different tools that we have in our toolbox that we can achieve in clinic that's going to really accelerate results. And so the next most important thing after feed is Boost and what we're going to do with you and how frequently you're going to come into clinic. Then we get into targeted. So once we've talked about feed, once we've talked about Boost, then we talk about what we may want to add or target. What's important about Target is sometimes you're going to be doing this at the intake or the first treatment plan, but more often than not, where you're going to get involved in targeted discussions is when they start to come back to see you for the treatments. Because this has given them an opportunity to be put on the feed system, to start to normalize their skin, and to start to promote the health of their skin. They're going to come into clinic, they're going to receive some treatments, which is going to further improve the results. And those are also opportunities for us to explore targeted treatments to further accelerate what we're seeing happening with the skin. So again, feed first, boost second, target third. And then as you can see within Target, what we've tried to do in this treatment plan is make it pretty point and shoot. What I mean by that is that what you're going to do is you're going to, if you're talking about moisture or dehydrated skin, you're going to focus on the Focus Care Moisture Plus products. There are 4 Focus Care Moisture Plus products. There's Super Moisturizer, there's Hydrating Oil Capsules, there's Alpha Night Cream, and there's Hydrating Serum. So basically there's 4 things to choose from. So again, you've put them on the feed system, you've brought them into clinic for specific treatments to accelerate results, and now you're talking to them about additional ways to target their skin concerns. The Super Moisturizer is $70, the Hydrating Oil Capsules are $140, the Alpha Night Cream is $90, and the Hydrating Serum is $110. The way to think about this, in my opinion, is that the Super Moisturizer and the Hydrating Serum are products that they're going to build into their twice daily regimen. So this is something that they're going to add to what they do in the morning and what they do at night. The difference is Super Moisturizer is full of, has some vitamins in it, but it's got 3 specific things that I'd like to point out. It's got pentavitin, Revidrate, and glycerine. What I like to do simply is think about Super Moisturizer as that build function. So what it's doing is it's helping accelerate the repair of the skin's barrier function. It's helping accelerate the production of natural moisturizing factors. And then there's a humectant in there as well, which is called glycerine, which helps attract more water to the skin. So it's hydrophilic. It helps attract more water into the skin. So Super Moisturizer would be if you have a skin type that's dry, you also have periods of dehydrated skin. Super Moisturizer is something I would build in to your base essential skincare that you're doing twice daily. Hydrating Serum, on the other hand, is hyaluronic acid, pure and simple. And so that is pure hydration into the skin. It's a low molecular weight hyaluronic acid and is just adding plumpness and pure hydration into the skin. So there's not much in terms of what it's doing with rebuilding the barrier function of the skin. It's pure hydration. And what I always like to suggest is that if you are going for the Hydrating Serum, you would also probably want to include a cosmetic roller in that, because it's really one of those, when we talk about penetrating hyaluronic acid, while it is low molecular weight, you still want to support it with a roller for sure. And so Super Moisturizer would be sort of like something that everybody who suffers from dry skin and dehydrated skin could add to their regimen. And sometimes it's seasonal, so in the winter, for example. And it's across the board, someone looking to maintain, improve, or transform. When we look at sort of, I would say, more of an older skin type, and we're looking at adding pure hydration, I would focus on the Hydrating Serum, hyaluronic acid. And now let's deal with the Hydrating Oil Capsules and the Alpha Night Cream. So the Alpha Night Cream is almost like a bit of a peeling hydrating effect, in that if skin texture is a real issue, you're going to, so roughness and sort of flakiness of the skin is presenting itself. What you can recommend is the Alpha Night Cream, which is going to be used sort of at night a few times a week, like 2 to 3 times a week. Which leaves Hydrating Oil Capsules. So Hydrating oil capsules are like little skin bombs. They're little capsules that are just chock full of everything your skin needs to normalize, improve cell function, cell health, and skin health. And so these are probably used a number of times a week. So I wouldn't suggest it's something that's daily. And it's used at night, so it's kind of like a bit of a go before you go to bed kind of accelerated treatment. And honestly, it's if you're looking to accelerate skin results, accelerate skin health, build and repair that barrier function, those hydrating oil capsules are really amazing. Also, when you have sort of an indication towards a dry skin type, meaning you don't have a lot of natural oils in your skin, that hydrating oil capsule is an amazing thing to recommend. So within this targeted section already, so we've built the feed program. So we put someone on Skin Essential or Youth Essential. We potentially introduced them to the body range. So they've got their core meal plan down. We brought them into clinic to do some boost, to do some specific treatments to try and accelerate repair function of the skin and rehydrate the skin. And then we're talking about targeted, which are very specific products that you're going to choose based on kind of what you're being presented with. I hope that was helpful. Obviously, when we're talking about this, finish isn't as particular when we're talking about dehydrated skin, although once that skin starts to come back, once the barrier function is repaired, once there's hydration, you get a truer representation of what some of the aging effects or sun effects are of the skin, how pronounced the wrinkling is, how pronounced the skin crepiness, the volume loss is. And that's a great opportunity to start to talk about what you might want to add in terms of injectables, neuromodulators, and fillers to achieve the ultimate look that someone's looking to achieve. So that's a bit about the Skin90 plan, targeting dehydrated skin. Just as a bit of a refresher, this is the Focus Care Moisturizing Range, again, within that targeted section of the plan. So you can see the night cream, which is glycolic acid and lactic acid, which is going to deal with some of the skin texture and also some of the rehydration of the skin. And here's some of the other products that we're talking about. So on the left is the Super Moisturizer. You can see the Pentavitin, the Revidrate. You can see the vitamin C and E. And you can see the glycerine, which is a humectant that's going to sort of draw water into the skin. You can see the HA Intensive Hydrating Serum, plump and smooth. So this is going to add volume. It's low molecular weight hyaluronic acid, so it's just pure hydration to the skin. And then you see that, that hydrating oil capsule balm, which is just chock full of retinol, vitamin C, vitamin E, and amazing antioxidants that are really going to help rebuild that skin, return it to health and hydration. So that's a bit about targeting, using the Skin90 plan to write a treatment plan that targets dehydrated skin. I wanted to present this offer code to everyone. So what we're doing following this webinar is a Try Me Focus Care Moisture Range giveaway. And so all the products in the range, we're going to give away to one person. So in order to enter that, please DM us this special offer code before March 19th, 2021. So you get a bit of time to send a DM that to us. The offer code is FCMR2021. FCMR2021. And again, if you'd like to enter to win one Try Me Focus Care Moisture Range giveaway that you can use to try the different products, please DM that offer code. I can see that I have broken my promise, and 30 minutes has turned into 45 minutes. I will get better at this. So thanks everyone for sticking with me through the webinar. I'm going to end it there, and hope to see you March 24th, where we'll be doing a similar treatment planning, Skin90 treatment planning webinar focused on aging skin. Thanks everyone. Take care.